Thank you very much, Mr. Chairman. And from the depths of my heart, I thank you again and again for holding this hearing. The issue has been my number one investigative priority for several years. And I'm so grateful that we're holding this hearing today and the drug companies, the FDA, and other stakeholders have been called here. Thank you for also sending joint document requests to these companies, Turing and Valiant. They both refused my previous request and obstructed our ability to investigate their actions. The fact is, we would not have the documents we have today without your action, and I thank you again for that. We have now obtained more than 300,000 pages of internal documents from these companies after they stonewalled. They include emails, analysis on revenues and profits, communications with hospitals and other providers, and public relations strategy documents. Earlier this week, I circulated 2 memos summarizing these documents. I now ask unanimous consent that they be made part of the official hearing record.
Without objection, so ordered.
These new documents provide an insider's view into how drug company executives are lining their pockets at the expense of some of the most vulnerable families in our nation. Their basic strategy has been to buy drugs that are already on the market and then raise the prices astronomically for a temporary period of time before other competitors enter the market. These companies did not invest funds to research or develop these drugs. They bought them, jacked up the prices, took as much money as they could out of the pockets of patients, hospitals, and others, and put those funds into their own coffers. I've called this money blood money. How much money are we talking about? Valiant reported gross revenues of more than $547 million on NitroPress and Isoprel, just 2 drugs. That's more than $500 million in 1 year coming out of the pockets of hard-working Americans. The company reported profits of $351 million on just these 2 drugs in 2015 alone. These stunning returns by Valiant CEO J. Michael Pearson on the Forbes list of billionaires. According to the press reports, these massive profits allowed Mr. Schiller, who is here today, on behalf of Valiant, to collect a salary of $400,000 per month, out of the pockets of our constituents. For Turing, the company reported $98 million in revenues for Diaprim in 2015, with manufacturing costs of only $1 million. Yet Turing actually tried to claim that it took a $44 million loss last year. The company reported that it spent $22 million on research and development. This money apparently went to donations to unnamed entities, quote, contributions to foundations, end of quote, and vague, quote, other research and development costs. But the documents we have obtained indicate that these expenditures were just as much about PR as R&D. Like a Ponzi scheme, it appears that Turing may be using revenues from Diaprim to research and identify the next drug it will acquire, and then impose similarly massive price increases on future victims. It's not funny, Mr. Shirelli. People are dying, and they're getting sicker and sicker. Based on the documents obtained by the committee, we know exactly what these companies will say as part of their public relations strategy. They will try to distract from their massive price increases by talking about their R&D. They will downplay their massive profits by claiming that they help patients who can't afford their exorbitant prices. The testimony from the drug companies today will be the same, but the difference now is that we've been behind their smokescreen. These tactics are not limited to a few bad apples. They are prominent throughout the entire industry. Lannett, Pfizer, Horizon, Teva, Avisar, Allergan, Endo, all of these companies have taken significant price increases on their drugs. The reason I care so much about this issue is because it directly affects my constituents and the constituents of every member of this committee, every member of this Congress. The people in my district are not on the Forbes billionaire list. They don't buy Wu-Tang Clan albums for $2 million. They can't liquidate assets to free up millions of dollars. They work hard. They get the early bus, and many take home decent salaries. But like many Americans, they struggle every single month to support their families and to pay for the increasing cost of housing, education, and health care. They live from paycheck to paycheck, and sometimes from no check to no check. Hard-working American families should not be forced to pay increases of 10%, 100%, or 1,000% just to subsidize the lavish lifestyles of hedge fund managers and corporate executives. As I conclude, I hope we can also talk about solutions today. For example, Secretary of State Hillary Clinton has sent letters to the FDA and the FTC proposing stronger regulatory action to crack down on companies that engage in price gouging. I think this is an interesting approach that could be significant bipartisan support. On the legislative side, I have introduced the Prescription Drug Affordability Act with Senator Bernie Sanders. One provision in this bill would allow HHS to negotiate drug prices for Medicare. This is something that even Donald Trump supports. There is significant bipartisan agreement on the need to address this crisis. According to the nonpartisan Kaiser Family Foundation, rising prescription prices are the top health care concern for all Americans, including Democrats, Republicans, and Independents. I hope today's hearing is the beginning of a sustained effort to address this issue in a bipartisan way. It should be addressed in a bipartisan way that brings much-needed relief to American families. And again, Mr. Chairman, I truly and sincerely thank you for this hearing. And just, Mr. Chairman, may I ask unanimous consent to take care of some business before we continue?
Yes.
Mr. Chairman, since I started this investigation several years ago, I've literally been inundated with letters from families, hospitals, and patient groups begging, not asking, begging for relief from these astronomical price increases. I have 12 letters here that I would like to include in the official record of today's hearing, and they have been signed by more than 100 different organizations. Obviously, I won't go through all of them, but some of them include the American Association of Poison Control Centers, the American Federation of Teachers, the California Poison Control System, Consumers Union, Fair Pricing Coalition, HIV Medicine Association and Infectious Diseases Society, Infectious Diseases Society of America, Human Rights Campaign, National Alliance of State and Territorial AIDS Directors, National Multiple Sclerosis Society. Finally, Mr. Chairman, there is one more letter I'd like to submit, and it is one of the first letters I received on this issue way back in 2011 and started this journey. This is a heartfelt letter I received from Brenda Fries, the coach of the women's basketball team at the University of Maryland. Coach Fries' son was diagnosed with leukemia and treated with a drug called cytarabine. Now, the interesting thing is that Coach, this is what the coach wrote. My son, Tyler, would not be alive today if we did not have access to the drugs that rid his body of cancer. Every family should have access to these drugs, and it is a shame that they are either not available or only available to the highest bidder, end of quote. I kept that letter with me for the past 5 years, and it has motivated me every day on this journey. And so I ask unanimous consent that all of these letters be included in the record.
Without objection, so ordered.
And with that, I yield.